What are you seeing are some best practices, clear understanding of the business case and what ROI you want to achieve that can be useful and sustainable for the future?
These days, being cost conscious, that's a plus there. Going through the process and planning, I think it's hugely important. Any common sense management group, even docs, even folks that are skeptical, when you can lay it out in a simple way with a good plan and show your improvements, to me, that's...
Hey everyone, welcome to Medical Practice Success Secrets. I'm Theo Harvey, the CEO of SensorMed. We're a remote care monitoring company that helps healthcare organizations. I'm super excited to have a guest. We're going to talk about rural healthcare and its importance and how it's shaping the future of healthcare. So I'd like to introduce Josh Braziel. He is the CEO of Rural Health Network of Oklahoma, a nonprofit consortium made up of 23 Oklahoma healthcare organizations. Josh's experience includes 18 years of rural public service leadership and 20 years in information technology and information systems. He has been involved in infrastructure planning and implementation projects ranging from the Department of Justice, multiple issues and things around HRSA, FCC, and USD telehealth grants. In addition to his duties at Rural Health Network of Oklahoma, Josh currently serves on the board of directors for the Telehealth Alliance of Oklahoma, the Remote Area Medical of Oklahoma, and has previously served on the Institutional Council of the American Telemedicine Association. Well, Josh, that's a mouthful, but how are you doing today?
I'm doing very well. How about you, Theo?
I'm wonderful. So I wanted to bring you in on this podcast today to talk a little bit about rural healthcare, right? The stats are interesting right now. Over 100 rural hospitals have closed over the past decade, and nearly 700 additional rural hospitals, which is over 30% of all rural hospitals in the country, are at risk of closing in the near future. So talk to me about why is healthcare in rural communities so important? What are you seeing now? What's happening in rural communities?
That's a topic we end up discussing several times a week. Different rural communities. This week it came up in Stroud, Stratford, Hugo, Oklahoma. I was having talks with folks about that exact same topic. And there's a whole, I was going to say there's a system. Every system is built to funnel everything upstream. A rural place like Oklahoma, our economy, all our services, they're funneled to the big city or out of state. So everywhere policy's made, all the decisions and the thought centers, we don't make the decision process. So every bit of everything is designed to funnel there. And it's almost like there's a mindset that if you want quality health care or access, you move to a city because that's where it is. But factually, there aren't that many cities. Everyone doesn't want to be there. Even if there were, there's still going to be folks working the land, out hunting, recreation. If you have a catastrophic accident up in the hills of Pushmataha County, a heart attack, you can't wait 3 hours for transportation to show up and 4 more to get to the heart hospital in Tulsa, Oklahoma City. There needs to be local and rural health care. I do a lot of telemedicine. That helps a lot. It's great for access, but I need that ER. I'm not going to get my tablet out and find the right specialist if I'm unconscious or injured a long way from town. Anyway, I could get on a soapbox and go on there forever. I'll let you talk some though, since it's your show.
Well, when I looked at the data, right, it looks like landmass of America, roughly 90% of all land in continental United States is rural areas. And it's still estimated around 60 million people, or 1 in 5, typically live in these rural communities. And so it's kind of like, why is this vast population of individuals, when it comes to healthcare, which is vital, is getting left behind, right? I know there've been talks about innovation, like maybe working with Dollar General or other, small retailers in rural communities to provide healthcare. But unfortunately, a lot of those got shuttered, right? And I'm wondering, obviously, with the closure of these large, healthcare systems in rural communities, we're saying telehealth is a potential option. Matter of fact, that's kind of how telehealth evolved, right? The need for communities to have access to healthcare. So because of the distances, they wanted to provide telehealth options, and that propagated throughout recently because of the need for, access to care in cities. But I'm just curious, as you've been in this area for such a long time, what are you seeing that could potentially work when you kind of think about the problems that's faced with it? Telehealth is a solution, partnering. What are your thoughts around how can we help communities that really are in bad shape right now?
I wish I had a real magic bullet. I can tell you the directions that we're going and the things that we are doing, because I think that's our path forward. So the rural hospitals, they're in a pinch, and there's a number of factors. If you think, if we narrowed it just down to, say, like MRI. If you're in a rural area with a high poverty rate, there's a number out there, and if your payer mix looks a certain way, you can't have an MRI because CMS is going to pay a certain rate, and you have to have a mix of different payers. So if you don't have that, you don't really get to operate one. Then you're sending all your patients to a large area where the mix allows that. There's so many things that are along those same lines. So we've got to get innovative out in rural. We got to save money however we can. And we can do a lot of that on the technical side. We can do a lot of that on the facility side. There's some advantages we have. Labor costs. I always joke that we've got plenty of parking. So you want a positive, we got plenty of parking out in rural space. We can always meet. But the folks who are successful, surviving and thriving right now, they're doing it as a group, and they're constantly mindful of that. And the bottom line, it's a breakover point about 80, 100 beds. The whole thought process and way of doing business is it changes there. Smaller than that, you're in constant contact with folks in your consortium group, friends in the industry, and you're honestly always got a pulse on that bottom line. You want to keep your facility open. And there's a double-edged sword in rural healthcare. So you have that hospital there. It's hard to find a MD or DO to come out and practice in a very rural area. And that next generation, it's going to be even tougher. So there's a whole loop there. The doctor needs to be able to send their patient somewhere. They can make that local. That's a positive too, but it sets you up on the next round. If your hospital isn't in existence, you're going to have a harder time attracting those folks. And talking about a very rural community, especially one with those same compounding problem, poverty and the payer mix the way they are, then it makes it even more important. If you lose that facility in your rural area, and there have been a number of reasons, even when the big systems come in, or especially when the larger systems come in, they fly that banner, try and do rural healthcare with an urban mindset, and a lot of times even that doesn't work out. Then the community's left to decide if they're going to shutter that hospital or try it again on their own when the larger system leaves. So you do lose that facility. Of course, it's an impact to the healthcare you can deliver, but you're pushing the cycle even farther down the poverty track, because rural community hospitals a big and important employer, economic driver for the town and the region, really.
No, you hit the nail on the head. I mean, just the economic impact, obviously jobs that can be brought to that community to help outside of different things that are happening in rural communities, and just to kind of make that community vibrant. I know there was a big push, and I don't know if that's still the case, where I think a lot of medical professionals, right, they could get the school loans forgiven if they spend some time in rural communities. Have you seen that program be successful in bringing in staffing and individuals who are excited about, or at least wanting to help the community and spending time there? Are we seeing some great results from that program?
That has been a huge help. Sometimes it's not long term. It depends on the individual. Yeah, there's a number of those programs out there, usually sponsored by governments, or in our area, we have several Indian nations, so Choctaw Nation of Oklahoma, Cherokee, Chickasaw, and the Public Health Service Corps runs a similar program. Well, forgiveness of tuition and student debt to serve in those facilities. So bringing those folks in, it does help. Honestly, we get so involved in it. I try and help recruit when I run into medical students who have a particular interest. If there's someone going into the profession who prefers to be in a rural area, we love to recruit them. I think they have so many opportunities out there because the recruitment, community support, additional supports they would receive moving out to a rural area would be pretty top. There's some urban advantage we can't compete with, money and other things, maybe political connections if that's important, but that particular candidate is interested in that. There's a lot of people reaching out to them. We'd like to have them out here too.
I love it. But I would say this, let's look at the glasses half full as well. Are there opportunities in rural care, right? One of the things, the government partnership, right, in rural communities, right, the big HRSA grants. As we talked about, the pandemic just happened. There was tons of money that was pumped out to rural communities to help with telehealth resources, right? And things of that nature from the FDA and other entities with government. So it seems like rural communities are kind of like the crucible where the government is allowed to put money into and test different ways to treat patients and populations. What are your thoughts about that partnership with the government? Are you seeing positive feedback from that and the innovations they invest in? Is that something that become eventually sustainable programs?
Oh, absolutely. And it's been a huge help. over the years. We've administered many of those for a very long time now. And it's a combination. It's education and being exposed to different things. Rural facilities wouldn't have come up with the capital to try out telemedicine when the technology was a big and expensive hurdle. We used a lot of grant programs to do that, and just the familiarity and having those things in facilities, I don't think we would have been there. They wouldn't have struck out and can't afford to make those kind of risky purchases. It has to be something that's proved out and guaranteed before they can afford to go that direction. All those early efforts, they're absolutely ingrained now. You've been in rural Oklahoma hospitals with me, so you can get your whole mental picture going here. You're walking into those places, and I do that a lot and ask them about what telemedicine they're doing. The places that say none, I would make you a wager if I were a betting person. We can go to their radiology and their emergency department. I would make a bet that they've got teleradiology going on. They probably have a telestroke program too, almost everywhere. And we pushed those other through the years. We had to build out the basic broadband network in rural Oklahoma to start the teleradiology. I won't count all those years ago because it'll make me feel old, but that's been a long time, and it's ingrained in the workflow now. Seriously, when you mention it, they are not doing telemedicine, but they're actually doing a whole lot of teleradiology. Probably telestroke too.
Yeah, and that's one of the things that I was always impressed with, the willingness, because of necessity, of course, but to try new technologies and solutions, right? And really, be honest with you, the reason why telehealth probably took off is because for decades, it was being baked and tested in the crucible of rural healthcare, right? And so you had actual health efficacy, the real results and outcomes because of the decades it was being used in rural healthcare to show there's opportunity here, right? To kind of treat patients at home. And I would also advocate, the things that we do with SensorMed, remote patient monitoring, that was done decades ago, right? Over landlines and being able to help patients at home. So these are technologies and solutions right now they're in the forefront, but it's something that I think rural healthcare was instrumental in just kind of starting the steps down that pathway, getting the clear results because, technology by itself is great, but in healthcare, you have to have the outcomes. And, I can remember myself going to rural Georgia, driving around and helping patients with their COPD assessment test, right? Using mobile app and just making sure that they could breathe properly and making sure they have pulse oximeters to ensure that they were taken care of after they were discharged from the hospital. And that was almost 10 years ago now, right? And just making sure patients were taken care of. And that was the basis for the reimbursements that kind of sprung up from remote patient monitoring. I will say this though, to your point, I think the economics has to make sense. And for a long time, they had programs that reimbursed the doctors in rural healthcare for chronic care management. And thank God recently, we talked about this, but they're starting to reimburse rural health centers for remote patient monitoring. Previously, if you remember, it was part of a bundle. I think we tried this at Hugo. We were going to do remote patient monitoring, right? And then we found out it was bundled in with chronic care management. So they didn't get their full reimbursement for all the services we were doing. So recently, and I think we talked about this, 8 years ago, finally, I think it was last year or this year, they finally were able to unbundle that. And now rural healthcare centers can now build multiple kind of remote programs, remote patient monitoring, chronic care management, some behavioral health. Are you seeing the proliferation of these type of reimbursement models being used in rural healthcare? And are a lot of providers in these areas, are they taking advantage of this?
I haven't seen a lot of that, and it seems like the news is still permeating. A couple of folks are aware of it now. I don't know if you've been calling and talking to them. I've been waving the flag, starting to get the idea. The program you were talking about a minute ago, based out of Hugo, Oklahoma, with all the chronic care management, I need to talk to those folks again because that's a big volume. And I can't believe it was a fast 7 or 8 years, but it has been. So, yeah, we need to loop back around on that one. I haven't seen a ton, but this year, it seems like there's been so many different regulatory, technical, and data changes that it's a bombshell every couple of months and kind of a reactionary scramble. I walked into a rural DO's office last week, so we're friends. Everyone in there, I'm on a first name basis with them. It's been such a year that, so when I opened the door to walk back down the hallway, the office manager saw me coming and said, oh, this can't be good if you're coming by here to deliver some news in person. So I think they were expecting another, your mandated data participation. Y'all are going to have to, another mandate. I think is what she was expecting. I had good news though, so it was a good visit.
Yeah, that's a good point. Are there a lot of regulations and mandates that get handed down that make the administration of rural health centers a little bit more tougher to kind of
It's
do their work?
RHCs in small facilities. I serve on some boards and we do some advocacy work for the smaller physician, smaller healthcare provider out there. And when the decision is made in a group of folks that are lawmakers, representatives from large and well funded universities and billion-dollar healthcare systems, and the idea is we're going to mandate a data project in something that costs, on the low end, you're going to spend $20,000 or $30,000 a year doing this, but you're also going to take on a data project, and we'll give folks several months to get ready for it. When I'm in the room and bring up the idea or the concept that that's actually a financial hurdle for some folks in the business, I bring up their names all the time in Oklahoma. I'll not throw them out on a national stage like this, but let me give you this example. Doctor who operates his business and the only employee is his wife. Between front desk, nursing, billing, they handle that as a team, and a data project that they can't afford, and $20,000 per year in ongoing maintenance that they don't have the option to opt out of. That could make the difference. That could help nudge that decision that maybe I will retire. And then that small community doesn't have their doctor anymore. They're going to be driving into a city for basic primary care or going the telemedicine route. So we do a lot of advocacy in that direction, but that's one example. And then the news and the way it permeates, we go around and break the bad news. I mean, if you're a rural doc and you're seeing 70 patients a day and you're not even taking a copay from most of them because that's what you do for the community, and these are the folks you see at the hardware store and on the street all the time. So you've got your head down doing that. You may have missed one of 1,100 emails that day that announced to you the mandate. So I make sure they know what's coming and that we're here to help out with those kind of things however we can, whether we can bundle it as a group or take on the data project, because, in an operation that's a doctor and his wife, they don't have a data scientist or a technical team in the basement to get that done.
And so that's the other side of the coin of the data, right? We talked about, hey, these are areas where you can try innovation and get outcomes, but then there's that data requirement. And to your point, they just don't have the resources to collect all the data as required. It was a big push. Remember when EMRs first got pushed out, meaningful use, right? And we worked with a lot of providers trying to understand, like, how can they understand how to use their EHRs more effectively and get the data. They just didn't have the cycles and time to do all that, right? And so that's where the EMRs had to kind of pull that data and help them with that. They brought in consultants to kind of guide them in that path. So similar sounds like in rural healthcare, right? Where you're trying to figure out how to make that a little simpler for them. Even in the things that we do, practices, whether they're specialty or primary care, they just have very little time, right? And so all these different mandates and solutions and technology, it has to be bolted with services, right? It can't just be, here's some technology, good luck with it. Here's some AI widget, right? That's the big buzzword, AI. It's going to solve everything. Not necessarily, right? Because I don't know about you, I've been playing with AI. It takes a lot to even come up with the right prompts and all this stuff to even get it to a point where it's halfway useful. And even then, you're still like, this is not exactly what I want. So these are the things that I think that people have to realize, that healthcare is always going to be services that has to be backed by technology, but services leads the forefront. And so, like you said, your team coming in, helping rural health centers and other communities, figuring out how you guys come up with an action plan to meet the mandate together. So they're not just all alone, because they're just not going to do it on their own. So that makes sense. So I want to kind of pivot a little bit. Let's talk about yourself as a technologist, as a consultant. I mean, look, you were in the forefront of telehealth before anyone knew how to spell it, right? And so I would just be curious. Someone saying, hey, I was at a recent an insurance conference, the AHIP, last week, and a lot of Medicare Advantage commercial plans, they said utilization went from 100% during the pandemic down to 20%, right? And so utilization for telehealth has dropped tremendously, after, people are going back seeing the doctor in person, and we're still running into the same issues, right? The staff is just overburdened. People are missing appointments. It's just the same kind of workflow. From a consultant standpoint, what are you seeing are some best practices to have a successful telehealth program that can be useful and sustainable for the future?
These days, being cost conscious, that's a plus there. There are many more options than there ever were. You can spend a tremendous amount of money just on the technology side, but there's technology that will do the job. And if you don't go in with the world's largest spend on the front end, and I'm just talking about hardware and technology wise, I think spending in planning, getting your workflow down, doing discovery of exactly what you want to do. Going through the process and planning, I think it's hugely important. Very old concept of, I'm going to put enough budget number on this and go my facility a large box of telemedicine, and bang, we're going to drop it in, so telemedicine's going to work. That's far from true. You can't run the programs that way, and a lot of them were in the beginning. And I've seen lots of closets and basements full of very expensive telemed hardware. So
yeah, I think you brought me in a few here and there.
I've shown you some of those. They're out there, and the facilities, universities, and grantees who don't advertise that, they've got them too. I've seen them and borrowed parts back and forth. That's built into that business. So I think if you have an eye on the bottom line and a good plan going into it, showing ROI over time and the tangible financial and service deliverable benefit to what you're doing, that's a successful telemed program to me. And I think any common sense management group, even docs, even folks that are skeptical, when you can lay it out in a simple way with a good plan and show your improvements, to me, that's the key to success.
I love it. So basically going in with a clear understanding of the business case and what ROI you want to achieve, understanding the technology implementation pieces of it, and then last but not least, having a way to continually improve the process over time. So ROI, understanding the infrastructure, and then finally getting the continuous improvement. Those 3 steps, it sounds like, could really benefit anybody's telehealth program, right? Whether you're in rural healthcare or in urban centers, as you look to kind of continue to scale this out. Because we see the benefits, patients want dual options, right? And we're going to see more and more of that. One of the things, just reading on stuff, home dialysis is becoming more important. We're talking about GLP-1s, right? All the, people getting weight loss drugs, trying to deliver to people's homes. Obviously what we do, remote patient monitoring. So I think telehealth care at home is still going to be vitally important. And so I think putting together a structure and infrastructure in place to kind of handle that is key for everybody. Now, this has been great conversation, Josh. Where can everyone reach you if they have questions about just, hey, I have a telehealth program, I don't know where to start. With your expertise, can you help me? Where can they reach you or find you and all that?
So email me, josh@rhnok.org. I know this perfectly neutral Midwestern accent can throw folks sometimes, so it's the acronym for Rural Health Network of Oklahoma, rhnok.org. I'm not a social media animal, I think probably from my time in working with those folks in technology, but I do answer email like someone older than me, so I'm good there, and that's a good main channel of contact.
Awesome. Well, Josh, I really appreciate your time and just explaining to us the importance of rural healthcare, the benefits of it, the challenges, but also the opportunities that can evolve out of this and the lessons learned, especially if individuals are looking to get into telehealth wherever they are. And so this has been insightful. Everyone, thank you for listening to Medical Success Secrets for your business and how you can grow and move to the next level. Check us out on the next podcast. But Josh, thank you for everything and look forward to speaking to you again.
Oh, thank you for having me. Been my pleasure and great to see you.
All right.